Everyone diagnosed with cancer in Yorkshire deserves access to evidence-based and high-quality cancer exercise programmes. Yorkshire Cancer Research is working with the NHS and world-class researchers to make this a reality for every cancer patient in Yorkshire.
The Approach trial is a study where we're trying to see if giving people advice to increase their activity along with using a smartphone app helps them to increase their brisk walking. And the app is a great way to help people with activity because they can monitor how much brisk walking they're doing in a day, they can choose how to integrate that into their lives in a way that works for them, and it gives them feedback so they can see how much activity they're doing every day.
I was diagnosed a year ago with breast cancer. The impact that it's had on me during the trial, I've benefited both mentally and physically. Before, I was suffering with aches and pains. My legs were quite sore and my bones were really painful. Since walking a lot, I'm not in as much pain, my legs aren't hurting as much, and mentally it's done wonders for my mental health. The progress I've made is unbelievable. I started off just like 3 minutes and kind of tired out, but I've just gradually increased because I've reaped the benefits.
My experience with cancer started about 3 years ago, and it turns out I had a tumour on my abdomen. The app specifically helped me just because it's constantly there in the background. Initially I was doing a 10-minute walk on the app, and I think within a few weeks I was getting to 30 minutes. Then a couple of weeks after I was doing an hour-long walks. Since using this app and getting more active, it's pushed me to do more, and I do want to get back to where I was before I ended up in hospital last July.
I definitely wouldn't have started walking without any of the apps. Well, I've gone from being a couch potato to using 3 apps and doing as many steps or as much mileage and seeing as much as my local area as possible.
Without this funding, we wouldn't be able to do this research and find out whether this is a way to help people. So we're really grateful to everybody who donates to Yorkshire Cancer Research.
It's very important that we find out the very best ways we can support people to do the right sorts of exercise alongside their cancer treatment, whether that's before, during or after their treatment. So trials like the Approach study are absolutely critical to us understanding how to roll this sort of intervention out across Yorkshire.